What causes fatigue in lymphoma patients? Imagine feeling exhausted even after a full night's sleep. That's often what lymphoma patients experience. Fatigue in lymphoma, including non-Hodgkin lymphoma, is a complex and common symptom. It doesn't just come from being tired. It can be persistent, severe, and not easily relieved by rest. Several factors contribute to this fatigue, and understanding them can help patients and caregivers manage it better. First, the lymphoma itself plays a significant role. When malignant white blood cells multiply uncontrollably, they compete with normal cells for oxygen and nutrients. This means healthy tissues don't get what they need to function properly, leading to feelings of exhaustion. The cancer can also trigger a pro-inflammatory state by releasing chemicals like interferon alpha and tumor necrosis factor alpha, which are known to promote feelings of tiredness and malaise. If the lymphoma spreads to organs such as the lungs, kidneys, heart, thyroid, or pancreas, it can impair their function, causing hormonal imbalances or organ dysfunction that further contribute to fatigue. Generally, the more advanced the lymphoma, the more intense the fatigue tends to be. Treatments for lymphoma, especially chemotherapy and radiation therapy, are also major contributors. Chemotherapy can damage the bone marrow, which is responsible for producing red blood cells. When red blood cell levels drop, a condition called anemia occurs, reducing oxygen delivery to tissues and causing tiredness. Hormonal imbalances caused by treatment, such as thyroid or adrenal issues, can also lead to fatigue. Steroids often used during treatment can initially boost energy but may cause fatigue later, especially when doses are lowered. They can also induce conditions like diabetes, which can worsen feelings of tiredness. Side effects like nausea, vomiting, diarrhea, dehydration, and loss of appetite drain the body's energy reserves. Pain and the medications used to manage it, including opioids, can cause drowsiness and fatigue. Additionally, sleep disturbances caused by treatment side effects, pain, or emotional stress can make fatigue worse. Beyond the cancer and its treatment, other medical conditions and psychological factors can intensify fatigue. Anemia, whether from the lymphoma itself or as a side effect of treatment, is a major cause of tiredness. Infections and fevers, which requiring energy to fight off, can also increase fatigue. Other health issues like lung, kidney, or heart disease, autoimmune conditions, low testosterone, hypothyroidism, and diabetes can all add to the feeling of exhaustion. Mental health factors such as anxiety, depression, and stress related to diagnosis and treatment are also significant contributors. The impact of fatigue on lymphoma patients can be profound. It can interfere with daily activities, social interactions, and overall quality of life. Sometimes, fatigue persists even after treatment ends, and it can become worse during disease progression or relapse. Managing this symptom involves addressing its root causes when possible. For example, treating anemia, controlling infections, and balancing hormone levels can help. Lifestyle approaches like maintaining a nutritious diet, engaging in gentle exercise, and seeking psychological support are also beneficial. Open communication with healthcare providers is essential to develop personalized strategies that can improve energy levels and overall well-being. In summary, fatigue in lymphoma patients results from a combination of factors including the biological effects of the cancer, side effects of treatment, other health conditions, and emotional stress. It is a multifaceted symptom that requires comprehensive care and support. Always consult healthcare professionals for tailored advice and management options, as each person's experience with lymphoma and fatigue can be unique.